Hello, everyone. Today I'll be discussing the role of resistance and functional training in cardiopulmonary rehabilitation and chronic disease management. The handout was designed to help patients and caregivers understand how strength-based exercise can safely improve movement, independence, and overall quality of life in individuals living with chronic heart, lung, and metabolic conditions. Many people with chronic disease experience muscle weakness, fatigue, poor balance, and lower endurance over time. These limitations can make daily activities like climbing stairs, carrying groceries, or standing from a chair much more difficult. Resistance and functional exercise help improve physical function and confidence while supporting long-term independence. Resistance-based training includes exercises where muscles work against resistance, such as resistance bands, body weight movements, free weights, or machines. Functional training focuses on movement patterns used during everyday life, including sit to stands, step ups, carrying movements, reaching, and walking tasks. These exercises help improve muscular strength, endurance, balance, and movement efficiency. These forms of exercise are especially important in cardiopulmonary rehabilitation because chronic disease often causes deconditioning and reduced physical function. Research has shown that properly prescribed resistance and functional training can improve lower body strength, walking tolerance, balance, and overall quality of life in patients with cardiovascular and pulmonary disease. One major focus of this handout is the connection between muscular strength and everyday activities. Standing from a chair is a good example because it requires low body strength, coordination, endurance, and balance. Many individuals with cardiopulmonary disease struggle with this movement because of muscle weakness, fatigue, or shortness of breath. Research has demonstrated that individuals with chronic disease often have lower muscular strength and functional performance compared to healthy adults. Reduced strength can increase fatigue, balance problems, fall risk, and difficulty performing activities of daily living. Improving strength through exercise can help make these movements easier and safer over time. Exercise programs for cardiopulmonary populations should always follow evidence-based principles, including proper frequency, progression, recovery, and safety monitoring. Most patients benefit from 2 to 3 resistance training sessions per week, using light to moderate resistance and gradual progression over time. Safety is especially important in these clinical populations, as clinicians should monitor heart rate, blood pressure, oxygen saturation, symptoms, and exercise tolerance throughout sessions. Programs should also remain individualized based on diagnosis, medications, symptom severity, rehabilitation phase, and patient goals. And as we go on to page 2, resistance and functional training work best when combined with aerobic exercise. Aerobic exercise improves cardiovascular endurance and walking tolerance, while resistance training improves muscular strength and functional movement. Together, these exercise approaches help improve overall physical function more effectively than either method alone. For example, a patient recovering from a cardiac event may combine treadmill walking with sit-stands, resistant band rows, and step-ups to improve both endurance and functional strength at the same time. Education is also important because teaching patients proper breathing, pacing, and symptom monitoring can help improve confidence and long-term exercise participation. So, in conclusion, the resistance and functional training are important parts of cardiopulmonary rehabilitation and chronic disease management. These exercises help improve strength, balance, endurance, mobility, and independence while supporting better quality of life and long-term physical function. When exercise is individualized and properly supervised, Patients with chronic disease can safely improve their confidence and ability to complete daily activities. Combining resistance training, functional exercise, aerobic exercise, and patient education creates more complete rehabilitation program that supports long-term health and independence. Thank you.